Thank you for your interest in a novel real-time PCR assay for detection of HLA-A 3101 in individuals being considered for carbamazepine therapy. This poster was authored by Kathleen Davis, Dr. David Kraus, Dr. Daniel Dowd, and Dr. David Robbins. All authors are employed by Genomind at the time of this presentation. Here you can see the full poster, and we will review each section. Let's start with a little background. In the practice of psychiatry, carbamazepine is often used as a mood stabilizer for bipolar disorder. Rare but serious adverse skin reactions, including Stevens-Johnson syndrome and toxic epidermal necrolysis, can occur with carbamazepine. An HLA-A 3101 genetic variant is associated with increased risk of these potentially fatal skin reactions. A common technique to identify the HLA-A 3101 variant is to test for a tag SNP known as RS106-1235. This SNP, however, is known to have poor specificity for HLA-A 3101 due to cross-reactivity with HLA-A*33. This poster will describe a different method for identifying the 3101 risk variant and quantify the false positive rates for this new method. Tag SNP RS106-1235 is actually found outside the coding region of HLA-A 3101. It's also found outside the region for HLA-A*33. The new method does not rely on this tagging SNP and instead identifies sequences unique to the HLA-A 3101 region using real-time PCR without having to sequence the entire gene. To validate this new technique, we used 120 unique DNA samples, which included 89 in-house buccal swabs obtained during normal business operations and 31 known Coriell samples. The 89 in-house samples were sent to a reference lab for HLA-A typing, and the 31 Coriell samples were compared to their known published NGS typing results. 6 Coriell samples contained very rare variants of HLA-A, including 3104, 3112, and 3116. There was 100% concordance between all samples using this new technique and HLA typing. The 89 validated in-house samples were compared to the prior results of tag SNP RS106-1235. The old tag SNP method results in a 41% false positive rate. The new technique described in this poster generated 0 false positives. The rare Coriell samples, 3104, 3112, and 3116, generated false positives, but these are expected to occur in about 3 out of every 100,000 individuals. This new, real-time, proprietary method for identifying the HLA-A 3101 risk variant was 100% accurate and 100% specific. On the left is a chart of the old tag SNP RS106-1235 technique. Of the 75 positive samples using the old technique, 31 were false positives. That's a false positive rate of 41.3%. On the right is a chart of the new real-time PCR technique, which generated 0 false positives among those samples. All 44 detected HLA-A risk variants were true risk variants. Table 2 contains the raw data used to generate the previous bar charts. This new PCR method for detecting the HLA-A 3101 risk variant is an accurate and specific process. It costs significantly less than next-gen sequencing HLA typing, and results can be generated in hours. Our custom real-time PCR assay for detection of HLA-A 3101 is significantly more specific than the commonly used tag SNP RS106-1235. Clinicians considering carbamazepine therapy for their patients will have a better understanding of cutaneous adverse reaction risk and can make improved, personalized treatment decisions. The following references can be found using the attached hyperlink or via PubMed. Thank you.